Hello guys. Today I would like to share with you my personal experience of treating epididymitis with acupuncture. Now, just to remind you what epididymitis is. We have a testicle, and from the testicle we have a muscle called cremaster that retracts and lets go of the testicle, and venous and arterial blood supplies travels here as well. And then we have a little sac called epididymis that is located on the side of the testicle, and then from the end of the epididymis comes the spermatic cord, and this is how sperm travels out from the epididymis through the seminal canal into the urethra. Epididymitis is inflammation of this sac, of this epididymis. And it's rather an acute and painful condition which causes swelling of the testicle and pain. And it is treated very well with acupuncture. But before we start treating it, we want to rule out another condition which is called testicular torsion. This is another acute condition, but this one requires immediate surgical intervention. Now, torsion is a twisting of the testicle where blood supplies to the testicle is cut out, and then it takes literally just hours before testicle dies out, and we want to send those patients to the emergency room. Testicular torsion usually happens in boys between age of 12 to 18, but can actually happen in any age. So we always want to be on the lookout for it. One way you can test for torsion is called cremaster reflex, where you apply a pressure with a blunt object to the inner thigh and see for cremaster reflex. When there is negative cremaster reflex and testicle does not rise up, that's a clear indication that there is a twist there. If you suspect torsion, send those patients to the emergency room. Once we have this condition ruled out, once we know that this is epididymitis, we can certainly treat this condition very effectively with acupuncture. Now, the good place to start when we try to identify this condition in terms of acupuncture diagnosis would be the 8 parameters. Now, would you say that this is an exterior or interior condition? And of course the answer is this is interior, because testicles located inside of the body and no exterior pathogenic factor has influenced it. Number 2, do you think this condition is an excess or deficiency? We have swelling and pain. This is definitely an excess. Number 3, is it hot or cold? Now, if you have inflammation and swelling of the scrotum, there is obviously an element of heat in it. And number 4, and this is a more challenging one, is this a yin or yang condition? Now, I would argue this is a yin condition, and I tell you why. Although we have a presence of heat here, and I'm going to write a character for fire in Chinese, this is heat, huo, right? And heat has a tendency to rise up. And yet we have this condition in the lower part of the body. And so there is definitely a yin type of pathogen that brings this heat down. This factor is actually greater than heat. Otherwise, heat would have prevailed and brought the other factor to the higher areas in the body. So this is definitely a predominantly yin condition. Now that we decided on the characteristics of this pathogenic presentation, let us decide whether this is a zangfu, the organ pathology, or channel. And the answer here is obvious. This is a channel pathology because none of the organs are involved into this presentation. This is a channel problem. In terms of the channels, is it an extraordinary channel issue or primary channel issue? And I would argue this is a primary channel issue. Why? Because this is an acute condition. If you were to deal with some sort of chronic condition such as varicocele, which is a varicose vein engorgement, or some sort of a cyst which has been persisting for years and comes and goes, then I would definitely consider an 8 extraordinary vessel as the target. Here we have an acute condition, therefore this is a primary channel. Now, in terms of the channels, which channels connect and rule this part of the body? We certainly have kidney channel that rules testicles, and we have liver channel which wraps around the genitals. Which other channel wraps around the genitals? Well, gallbladder channel also wraps around the genitals. So out of these 3 channels, which channel do you think would be the most appropriate, our target? And I would argue that it's not the kidney channel. Why? Because kidney channel rules the testicle proper. And if you had some sort of issue with either sperm count or some sort of sperm pathology, we would choose kidney channel. We would also choose kidney channel in case of lower libido or some other problem that affects the testicle itself and its function. But here we have an inflammation of the tissue surrounding the testicle, connective tissue, and this is definitely a liver and gallbladder problem first and foremost. And I would further tell you that liver is, in my clinical experience, is the channel that needs to be targeted first and foremost to quickly treat this condition. Now, we discussed a little bit the nature of this pathogen, and in order for us to come up with a treatment strategy, let us speak about the mechanism, how this situation works in the liver channel. And so we know that we have dampness and we have heat. And we know that dampness is greater than heat. Now, dampness, in fact, we can say, as a predominant factor, causes stagnation of qi, and qi stagnation causes blood stagnation. Why in this sequence? Because qi flows, blood follows. And we can also argue that heat is secondary to qi stagnation because qi stagnation causes heat. That's why it's a yin factor. That's why it's a yin nature disease, as I see it. And therefore, treatment strategy should be to drain damp, and number 2, move qi. In terms of the 5-element characteristics, which points should we choose? Well, naturally, dampness can be drained, or you can dry dampness. To drain dampness, we use water points. Water phase drains dampness. Kidney channel drains dampness. Points that have water characteristics, especially yin channels, He points on the yin channels, they drain dampness. But to dry dampness, we use points with earth characteristics. And qi stagnation is treated with points that have metal characteristics. Because lung rules qi and metal moves qi stagnation. Also, it's interesting to note here the following. And this is fire in terms of the 5-element relationship. This is fire, earth, metal, water, and wood. Now, liver channel belongs to the wood system, and we have an excess in the liver channel. And so metal points will control wood, will help to reduce wood stagnation, and earth points will harmonize. And so we need to choose right points on the liver channel. Let's see. Liver 1 is a wood point on the wood channel. It definitely treats testicular pain and stagnation. But would it be a great choice for our problem? I would argue no, because from the 5-element characteristics of this point, we can tell this point treats pain that comes and goes, that may occur in different parts of the testicle or genital region, but it definitely will not treat swelling. So this is definitely not my point of choice for this presentation. Liver 2 is a fire point on the wood channel. And just like I said, we do have some presentation of heat, and definitely a fire point on the liver channel will have some draining effect. Therefore, we can use this point. But again, this is not the point of choice unless we have a situation where heat is very, very expressive. Also, think about liver 2 in terms of the holographic representation here. It's located between the big toe and the second toe, right here in the wedge. And this is holographically the area that is represented by the crotch. Okay, so it's a very attractive point. But just like I say, this point is used primarily in case heat. Our next point on the list is liver 3, a source point on the liver channel. And we know about source points that they treat both excess and deficiency in the channel. And therefore, this is definitely our point. This is the point that we definitely want to use. Accidentally, combination of liver 3 and gallbladder 37, a source and low point combination is a treatment strategy to treat pain and swelling in the testicle. And we definitely can use gallbladder 37 and liver 3 as a therapeutic axis, and the rest of the points can be built out around this axis. Next point on the list is liver 4, which is a metal point, Jing River, and the metal point on the wood channel. And again, this point has a controlling phase, a controlling relationship with the liver channel. In other words, it's going to reduce any sort of excess, and Jing points are specifically indicated for pain. And this is definitely a point of choice for this presentation. And finally, we have a He point that is liver 8, which is a water point on the wood channel. And just like I said, there is dampness as a predominant factor here, and we can use this point. And my only objection to this point selection would be that this is a nourishing point for the wood channel, and therefore I would be very cautious with using it personally, because we can use other points which have water characteristics would be helpful in this situation. I'm going to leave it out. Presently, I'm not using this point for this condition. Next, we can choose some other channels to treat this condition. And I would say that my next channel that I'm interested in would be something that deals with dampness directly. And this is definitely a spleen channel, because earth dries dampness. And the most obvious choice here, of course, is spleen 9, because it's a water point on the earth channel. And therefore, this is a great point to dry dampness and also to drain dampness. And this point actually works very well for testicular swelling. And another point on the spleen channel I like to use is spleen 6. This is a point or intersection of liver kidney and spleen channel, and therefore it kind of combines, it connects well with the liver channel, which we already kind of activated here. And this point also has indications to treat testicular and scrotal pain and swelling. Next channel on my list would be Sanjiao. Why Sanjiao? Because Sanjiao channel deals with heat and dampness. Damp heat is the primary channel to treat damp heat. And we can use Sanjiao 10, and because it's an earth point. But my primary interest would be in Sanjiao 1 as a metal, because it has metal characteristics. And I tell you more, I would not even use Sanjiao 1 directly, but there is another point. In Master Dong acupuncture system, there is a point called Huang Chao. 11.06 Huang Chao. Huang Chao. Returning the nest, and this point is known. This point is treated a lot in gynecological conditions. Hence the name of this point, return nest. But this point actually works wonders for the testicular swelling and pain. Okay, and it's located on the ring finger. If this is a ring finger, this is a middle finger, and this is index finger. And so this point is located on the yang side, closer to the thumb, in the second phalanx, right in the middle of the second phalanx, in the area between red and white flesh. And you can pierce it all the way to the bone. It's actually not as sensitive, and I've needled it on an 11-year-old boy recently, and it works just fine. Okay, so you just needle it towards the pinky, like this. Okay? So Huang Chao 1106 is definitely a point of choice for this condition. And the final point that I would like to share with you guys is large intestine 4. And again, I would choose Master Dong location for this point, which is, this is the metacarpal bone. This is the phalangeal bone, right? So if this is metacarpal bone, I would go all the way to the end of this bone just before it swells up and pierce the point right beneath this bone here. This would be the regular location of large intestine 4, but I would actually go further down and needle it towards small intestine 4, like this. And this is called Lingu location of this point, and it's also very good for resolving stagnation in the lower part of the body. And incidentally, you can see also large intestine 4 and liver 3 form a very nice combination, which is called Sumon, 4 gates, which is a great combination to reduce stagnation. So these are my points that I would use for this presentation. So now we have our point selection, and let's see how can we create a treatment out of these points. Now, those of you who know my work know that I always start with the point that is not necessarily related directly to this problem, but rather something that will create chi wave. In other words, I'm going to use the point that is open at the particular time of the treatment. You guys know about the ebb and flow of chi in 24-hour cycle, and this is one of the cycles that can be used for this system. So this is going to be 12 noon, and this is going to be 12 midnight. And we know that at noon we have heart channel, and at midnight we have gallbladder channel open, right? And gallbladder, then it comes liver, lung, large intestine, stomach, spleen, heart, small intestine, urinary bladder, kidney, pericardium, and sanjiao, right? Suppose our treatment comes, I don't know, at this time, spleen time. It doesn't have to be spleen time, it can be any time, but spleen. And we would choose spleen 3 as our first point in the sequence. Why? Because it's the source point of the spleen channel, and this is where the chi is at the moment. And so we're gonna needle this point to create a wave of chi, and we're gonna push this chi through the sequence. So I'm going to be using points on only one side of the body. In other words, I'm almost never use 2 liver 3 or 2 spleen 3 points, just one. This is how my treatment is going to look like. Let's say this is the right side of the body, this is left side of the body, this is arm, this is leg, and this is leg. Right arm, right leg, left arm, left leg. If I have points in the torso, I'm gonna make a square in here. If I have points in the head, I have them here, right? And this is gonna be my navel, right? So, and let's say we have a testicular swelling on the right side of the body here. In that case, we're going to try to focus our treatment on the opposite side of the body. In other words, we're going to choose liver points and spleen points on the left side of the body. So I'm going to start with spleen 3 to wake up the energy. Then I'm going to, since spleen channel is open, we can add spleen 9, spleen 6. Oh, by the way, about spleen 6, one more thing. It's possible to bleed this point in case you find a purple vein. In fact, you can actually look through the whole spleen channel, because spleen controls blood, and if there is an element of blood stagnation, you may often find a purple blood vessel along the spleen channel somewhere from spleen 10 to spleen 6, and you can prick this vessel with an intravenous needle. Okay? So we open the spleen channel. Now, spleen channel gives us access to the sanjiao channel. Why? Because spleen and sanjiao channels are connected as a yin-yang, as a midnight, midday. This is a midnight, midday rule. So spleen is opposite to the sanjiao channel. So we can use huang qiao next. Okay, sanjiao 1 or sanjiao 11.06 is going to be used next. Sanjiao channel is open, and it gives access to the gallbladder channel. Now, gallbladder channel, we're going to needle on the same side, because this is going to be our yin side of the body, this is going to be our yang side of the body. Sanjiao and gallbladder form a Shao-Yang pair. Gallbladder channel gives us access to the liver channel, the gallbladder 37, liver 3, and liver 4. If you choose some other liver points, you're welcome to add them here. And the final point on the list is large intestine 4, which is going to be needled here. And I can definitely needle it next, because the liver channel and large intestine channels are connected as a so-called extraordinary pair. Arm Yang Ming channel and foot Jue Yin channel are connected, and a basic rule is like this: Yang Ming, Jue Yin, Shao Yang, Shao Yin, Tai Yang, Tai Yin. So this is the extraordinary channel connection, and if you use hand Yang Ming, it's going to be foot Jue Yin. If it's going to be foot Yang Ming, it's going to be connected to hand Jue Yin. So this is my treatment strategy for treating epididymitis. So I hope you enjoyed my presentation. Please press the like button and subscribe below. More content like this is coming. Thank you. See you next time.